unfortunately, some of us have been bought by the pharma industry. Some of us have enjoyed holidays in exotic places, registered at conferences, given free seats, travel up and down, and one has not contributed much, but you may have probably been pumping some of their products in your place of practice, whether they were required or not. And I think that relationship has to be a very transparent one. And we have a clear example in the Society for Medical Learning Resources Transfer, which in their introduction says is entirely independent and receives no grants or assistance from any public or private body. I'm sure the Arjuns cannot be bought. Yes, technology has infiltrated into our lives. Today, doctors have power to make decisions that affect destinies of patients. That's one side. On the other side, it's given us a lot of insight into clinical situations and helped us in better diagnosis. It would be worthwhile to stop and think of Dr. E.V. Kalyani, who offered good care, probably for a part of her life without the use of ultrasound, and helped to solve many clinical issues without the use of ultrasound. Today, you and I can't think of practicing OBGY without that machine. But it's a double-edged sword. You get to see minute, exquisite details of the fetus very early, and this can help you in prenatal diagnosis. But on the other hand, you can also get to see and detect the gender of the fetus early. Unfortunately, this has led us to female feticide. And unfortunately, in Tamil Nadu, particularly in Salem district, we have a drop in the female sex ratio. I'd like you to stop for a while and think of Dr. E.V. Kalyani, who was a child widow, and her father encouraged her to be a doctor, and she was the first MD in Tamil Nadu, and we go back to 1937. The world would have been poorer if she was removed because she was a girl child, or if she was cast aside because she was a child widow. These are important issues we need to ask ourselves. And what is even more shameful, for a fee, the ultrasound person can identify whether it's a girl or not. For an even bigger fee, a lady obstetrician stroke gynecologist removes a female fetus. I'm not sure where we are going with this kind of an attitude. Today, we are very fortunate. Life can be created in a petri dish with a single cell from an embryo before it's implanted. You can get a lot of information. With a syringe, you can identify the sex, health, personality of the potential human being. We are lucky, we can have designer babies. You can have your son with blonde hair, blue eyes. You can probably get him to have the ability to play the flute, have a face like yours, and a voice like your dead wife's. Yes, assisted reproductive technology has changed the face of things for a lot of us. Interesting to know that in January of this year, after a series of scandals, IVF experts decided to sign a code of practice. We all know about the mix-up of embryos in a clinic. We also know, and this I know for sure because the young lady who worked in the ART center needed extensive counseling and psychiatric help, because she was shocked to find that in that very popular center in the twin cities of Hyderabad and Secunderabad, they were inseminating donor sperm and the patient was not aware. She was under the impression that it was her husband's sperm. We also know of Dr. Paul Fielding in the UK, who finally got imprisoned because for months he fooled women that he was actually transferring embryos when he was doing nothing. That is why UK has a very strong body that controls these ART centers. No license is given, and centers are closed down if there is any hanky-panky. Well, let us find a little comfort in knowing that there is a draft that has been written in this country. The ICMR and the National Academy of Medical Sciences, along with a whole group of experts from across the country, met and wrote out this draft. And hopefully it will be discussed in the winter session of Parliament. That should give us some hope. Down to the basics. Primum non nocere. First, do no harm. Let me take you on another journey. This is an 18-year-old, married, within 3 months was dragged to an obstetrician by her mother-in-law. The obstetrician gave her clomiphene, gonadotrophins, and a host of other drugs. The lady landed up in a critical condition in our hospital with ovarian hyperstimulation. Her HCG levels went through the roof of the hospital, and we have 5 floors. And Geeta was shocked out of her skin because she discovered 9 gestation sacs. Put the picture in mind, an 18-year-old, married just 3 months ago. And we had a hard time trying to figure out what to do. And by 9 weeks, she had 7 viable gestation sacs, fetuses, in that little womb. So she opted for fetal reduction. And she went to a center where this was done, and over 3 sessions, reduced it to twins. She flew to the US, and at 25 weeks, had pre-viable premature rupture of membranes, lost 1 baby, and 1 baby survived after a prolonged NICU stay. That 18-year-old, I am sure, ladies and gentlemen, turned 40 at the end of that journey. We need to ask ourselves, has ethics disappeared from our lives? The questions this young lady threw at us, which we found difficult to answer because I don't deal with ART, though I deal with the success of patients from these centers. Why was I not told about all these problems? I don't know the answers to these questions, but I only know that we have to ask ourselves, what is our stand about informed consent? I know sometimes I'm guilty of trying to veer the conversation or the discussion in a particular area, maybe to suit my needs, I don't know. Sometimes it's difficult because you're not sure how much the patient has grasped, all that you are telling her. Well, whatever be the situation, it is the patient's right to know all the problems, particularly if you are giving her treatment options, then give her all the information. We've had 3 patients in the recent past who chose not to undergo radical surgery or chemotherapy or investigations when a malignancy was discovered. They chose to have their babies instead. Hear the mother's plea, because what they want to do is to enjoy that life that they have, and they're not sure how much time they have. They want to enjoy time with that child, or they want to enjoy motherhood for as long as God or whoever has given them that life. And we need to respect that. I've just chosen these examples because these are sometimes difficult examples, and we decide that a patient needs termination. She's got cancer. How can she do this? She can't think. But there are times when we need to listen to the voice of that mother, because what